Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey everyone. This is Dr. Burton, and I really want to welcome you back to the next episode of the Dr. Mama Says podcast. My last episode was about 2 months ago, and I addressed some of the changes that you may or may not have discovered if you needed to go to a physician visit during this pandemic. Safety remains our top priority, even when it causes some inconveniences. We hope you understand. But like you, I had hoped by this time of year that the worst of the pandemic would be behind us. I want to get back to sharing my parenting tips as well as some general ENT information. But we are far from out of the woods with this COVID pandemic. I belong to many Facebook groups where physicians share research and discuss the healthcare concerns that we're seeing in our practices. Many times I hear about trends that happen before they make it to the news cycle. And as a pediatric ENT, I'm not that physician who's treating many of these actively sick patients. So I have personally learned a lot from my colleagues. And now that cold and flu season is right around the corner, we may be headed for some really rough times. So I decided that now it's time for me to share with my audience many of the things that I've learned from frontline physicians and the things that they're telling their patients that can help them to beat COVID infections while they're still at home. Yes, I realize that my post is titled Physician Secrets, but I was just being dramatic. These are tips that I'm sharing that are not actual physician secrets because they can be really found online, but they're great resources to help people to sort through all the noise that's flooding the internet. Which treatments are real? Have they been proven? Which ones are supported by physicians and scientists even though they've not been proven, but they make sense? The bottom line, we could all use some help in deciding which things we can use for ourselves and our families to beat the COVID infections at home. Every choice we make in life doesn't have to be the absolute best one, because who actually defines best? It could be different for different people, but the choice you make should have some type of reasoning behind it, not just some gut feeling or because all the cool kids are doing something or because you heard it on the news. These factors can be considered your starting point, but you should follow some type of process to help you decide what to do next. I want to share a little story with you before I get into the meat of this, where I was surprised by one of my colleagues because he asked me if my goal was to avoid getting COVID-19. Yes, that was a real question. And I simply replied, well, yes, as a matter of fact, that is my goal. And he shrugged and said he doesn't really think that should be the goal. He feels that a more reasonable goal is for us to all get the infection at different times so that we don't overwhelm our healthcare system. I'm still a little bit stunned. But I'm grateful for the conversation because it helps me to understand why some people do not seem to be concerned about following the public health recommendations. They simply have different goals. There is a huge range of symptoms from COVID-19, and no one can predict what their symptoms will be. This is a terrible disease that impacts the young and the old. It also impacts the healthy as well as those with pre-existing medical illnesses. Please do not be fooled to think that you are immune from contracting a severe course of this infection. We are all at risk. I am a Black woman with a family history of autoimmune disorders, and sadly, I recently learned that my age put me into the elderly category. Who knew? But these factors put me into that most obvious high-risk category for a poor outcome if I were to contract COVID-19. So heck yes, my goal is to avoid contracting the disease. But if I were to get it, or if you were to get it, we all need to know what should we do at home. A lot of emphasis is put on people who are sick in the emergency room and in the hospital, but if you're battling at home, what kinds of things should you be doing? Well, first, preparation is key. COVID-19 infections can be rapidly progressive, so please be sure to stay in contact with your personal physician throughout the process. At some point, they may be recommending that you go to the emergency room or an urgent care center. And most of you by now understand that if you want a COVID test, it's not always an easy thing to get. Despite ongoing demand, there is still not an adequate supply of testing kits that allow physicians to test patients in the way that they feel is necessary. Usually you have to go to a specific testing site where you may or may not need an appointment to get there. Do not assume that you will be tested at your physician's office or an urgent care center that you go to. It's always important for you to call ahead. Call to your physician or the urgent care center. Ask them if you should come in, if you should have a telehealth visit, or if you need to go somewhere else for testing. Preparation is key. So again, the goal of this post is to help you to make a more informed decision about taking care of yourself and your family members. Many of these items and tips have been useful for parents as they prepare to send their kids away to college. Now is a good time for you to consider stocking up on items that you or your family may need. First things first, we should all be doing our part to prevent spreading the disease. Regardless of your assumptions about whether you will contract it or whether you'll contract a mild case or not, you can very easily spread the disease to a close friend or a relative. So, make sure you do the basic public health things that are said over and over. Wear a mask. Wear a mask. Please, please wear a mask. Frequently wash your hands for 20 seconds. I am seeing more people wash their hands, but now they're kind of getting back to the in and out under the faucet. It's 20 seconds. Get that soap and water, rub those hands together, sing happy birthday twice. Avoid touching your face, sneeze or cough into your elbow, avoid large social gatherings, and of course, social distancing or perhaps physical distancing is a term you may prefer, but keep 6 feet away from others. These are basic public health measures. Do your part. You may notice that I said wear a mask 3 times in a row. That's because I am definitely on team mandatory wear a mask. Masks are so important. Whether you know you have it or not, we could be spreading it. Wear your mask. Although the masks are primarily to keep us from spreading the infection, there's some recent data that suggests that simple face coverings may also provide some benefit to keep you from catching it. So wear the mask. Also, as we talk about prevention, one of the other questions that comes up a lot is what happens if I'm exposed? If you or a family member are exposed to someone with COVID, there are some really good practical tips that you can use in that situation. Should you be quarantined? How long? So what does it mean being exposed to COVID-19? In the show notes, I added a link to a post by one of my colleagues, Dr. Kristen Stuppy, who really created a great post about what you should do after that exposure. Preventing the spread is something we all have to do. Another thing that we all need to do is to just maximize our general health to be in the best position to beat COVID-19 infections or any infections. Get a good amount of sleep, drink plenty of water, eat fruits and vegetables. I know this sounds mundane, but now is the time to get all these things in order. Limit how much you're eating highly processed foods. Get exercise. Spend more time outdoors. I don't know about you, but during this quarantine time, I've actually been outside walking in my neighborhood more than I have in the past 20 years. Monitor your temperature. When was the last time you checked your thermometer? If it's not working, get a new one. Also, get a flu shot. Now is the time. Flu shots work. Vaccines in general work. Now is not the time that I'm going to launch into the whole discussion about what vaccines do. Vaccines have changed the health of our world. And of course, there is no COVID-19 vaccine. We are all eagerly awaiting one, but there's still much testing and data analysis that needs to happen. I understand the desire to rush a vaccine through, but if it's not done correctly, the way we have done for so many other successful vaccines, I'm afraid we could delay our recovery from this pandemic even more. The United States has very strict regulations before approving vaccines, and it's kind of alarming to see that things might be wavering. Russia has suggested that they're going to approve a vaccine before they have finished phase 3 trials, and that data has not been shared internationally or verified by other renowned scientists around the world. Yes, Russia wants to be first. They want to win the race for the COVID vaccine. But the U.S., the United States, needs to be better than this. We need to stick to our protocols that have time and time again proven us to develop the most outstanding vaccines. Time will tell how this vaccine development goes. I have my fingers crossed, hoping we do not compromise our process. Now, as I step off my vaccine soapbox, let's briefly chat about some over-the-counter medicines you want to make sure you have at home. Many people already have some of this at home for any viral illness, but I've also had people who said, "Oh, I don't have any Tylenol." Well, check your supplies. Tylenol, Motrin, Mucinex, or some other product that has guaifenesin, which thins mucus. It's always a good idea to keep that mucus flowing instead of clogging up in the lungs, or in the sinuses or ears for that matter. Just a little ENT plug there. Get some Pepto-Bismol. It's a good thing to have on hand because COVID can cause a lot of stomach problems too. And a good cough syrup. Now, let's talk about some vitamins and some supplements that you might find helpful for fighting COVID. I need to emphasize that I am a scientist and I fully understand that some of the treatments that I'm going to be talking about are not the magic bullet. They do not treat any specific illness. However, our bodies are extremely complex and require many things to work at their best. Now that we're entering into this discussion, I want to share that many frontline physicians have recommended to their patients who are sick with COVID, but they're healthy enough to stay home, they have recommended these regimens. These therapies that I'm going to talk about, I'm really just going to help you to understand because you may have heard some of them floating around, but you may not know what they do or do not do. So keeping in mind that many of the problems occurring with COVID-19 happen because of inflammation, it makes sense that some of the vitamins and supplements recommended are very effective at combating inflammatory reactions. In general, the vitamins and supplements that I'm going to be talking about have been based off of some research. There obviously needs to be more research, and there are no studies that say this works. But as we're doing things to help us move forward, if these are things that can help us to fight, there might be something that you want to consider. So first, how about that vitamin C? This is a well-known thing that when you're sick, you drink lots of orange juice, you take extra vitamin C. But what does it do? Well, having a vitamin C deficiency is a bad thing. Many people may remember it as a disease that sailors got when they went out to sea for a long time. It was the dreaded scurvy. Did I sound like a pirate when I said that? That was my goal. So anyway, they learned to bring lemons and limes and oranges, but vitamin C has been studied extensively, and it may have some properties that help with viral infections. In the lab, it actually killed viruses, but those kind of antiviral reactions don't actually happen in the body, but this is why science is so important. What happens in a test tube or in an animal may not actually happen in humans. Nevertheless, high doses of vitamin C has been shown to shorten the course of a lot of viral illnesses. And what does high dose mean? Well, often it's recommended to be taken 500 milligrams twice a day. Sometimes people take mega doses, mega doses. Well, doing extra above that is not any more helpful. It's a waste of your time and your money, and it actually just floats through your body, and then we excrete it in the toilet. That's not what we want to do with that vitamin C. Next, how about vitamin D? Well, to start with, there are several types of vitamin D. So when I'm talking about it, I'm talking about vitamin D3. So if you're taking that supplement, look at your bottle and make sure it's D3. They're not all the same. Vitamin D deficiency was discovered in kids who had poor forming bones, and they had a disease called rickets. These kids also were noted to have a higher incidence of infections. So many studies have been done with no clear evidence proving that it works, but there's some data to suggest that higher doses of vitamin D3 have an impact on reducing infections. Back in the day, many grandmothers insisted on giving kids a tablespoon of cod liver oil to keep them healthy. Yuck! But it turns out Grandmama knew best. Vitamin D3 has been found in high amounts in cod liver oil, and it helped kids to fight infection. So research isn't exactly clear on why it is, but vitamin D interacts with the immune system in some kind of way and triggers a reaction that helps to fight the viral infections. So that might be something else you might want to look into. A recommended dose is 2,000 to 4,000 units a day. On to zinc. Zinc is a trace element that is essential for our bodies to use for growth, development, and maintenance of our immune systems. A zinc deficiency is actually relatively common, impacting up to 25% of people in some developing countries. a zinc deficiency leads to a compromised immune system. Zinc is critical for our bodies to mount an antiviral response, and it's also been shown to have direct antiviral properties against some viruses like the flu. So remember, when we say viruses, we're talking in general, common colds and lots of other viruses. But the flu, influenza is actually in a category all on its own. And there's a variety of things that work specifically for the flu that don't work as well for others. But anyway, zinc is useful, often recommended in doses of 75 to 100 milligrams a day. The next supplement that might be useful is one that might surprise you, melatonin. So many people have used melatonin over the years to help them with sleep. I recently shared a post about how we used it for our dog who was losing his hair, and it did help the hair grow back. Not sure why, but just something to keep in mind since it clearly does something to make your hair grow back. But anyway, who knew that this sleep aid actually has known properties which are helpful at combating viral illnesses? When I looked into the mechanism, I found it to be very heavy science, a little bit too deep even for me, so I'll spare you the details. But if you're a physician who wants to know more about that, I added a link in the show notes. Bottom line, melatonin disrupts some part of the immune response that's needed for the virus to reproduce. So bottom line, taking melatonin at night may help you sleep while it's also secretly blocking the virus from causing more damage while you're sleeping. A recommended dose is between 4 and 6 milligrams. All right, so the next one I'm going to talk about is something I had never heard of before, and I'm not even sure I'm going to pronounce it right. It's called quercetin. That's spelled Quercetin. And just to share that since I'm also building up my war chest in case my family contracts COVID, I got some of this. I'm just hoping that one day I'll be throwing away an unopened bottle, but I have it in my toolbox just in case. So what is it and how does it work? Well, it's a substance that's found in fruits and vegetables. It's been studied quite a bit, and it has some abilities for fighting cancer cells, viral infections, reducing inflammation, and it's a great antioxidant. There's also been quite a bit of research suggesting that there's some benefit in reducing cardiac disease. I might need to rethink throwing away that empty bottle if I don't use it for COVID. I may need to hang in there with that after this pandemic is over and talk to my colleagues about the potential benefits since clearly I'm getting up there in age. But I digress. Anyway, physicians do recommend a dose of the quercetin of 500 milligrams twice a day. And the last one I want to touch on is elderberry. This is an herbal remedy that's been studied and shown to have some activity against viruses, especially the flu. It's also got some good anti-inflammatory properties. It's best if it's taken within 24 to 48 hours of symptoms starting, and it's been suggested that it reduces the length of any viral illness. Some people feel it works similar to the prescription drug Tamiflu that's used for influenza infections. It comes from a dark purple berry in Europe. Although this sounds good, it's actually not been recommended by a lot of doctors, but since some of them did, I put it in here for completeness. There seems to be more potential side effects with this one. For instance, it's definitely a greater concern if you take this for over 3 months, whereas the other ones don't tend to have these risk factors. There's also a significant risk with interactions with some of the medications. And also, because of how it works, it may be an issue for people who have autoimmune disorders. So definitely do some research on the elderberry, but it's something to be considered. Now, of course, there are many, many other supplements and vitamins out there that people take. Dietary supplements may have side effects. They may interact with medications. And it's also worth pointing out that over-the-counter supplements and vitamins are not regulated by government rules, so the quality and the amount that you may get could really vary a lot depending upon which brand that you get. I am simply highlighting the ones that experienced physicians have actually recommended to their patients, so of course I recommend that you discuss these with your personal physician if they're of interest to you. Now, on to some respiratory therapies that may help you to fight the effects of COVID-19. COVID impacts all aspects of the body, and in the show notes, I added links showing some of the things that happen to skin, heart, brain, kidneys, but the lungs are the most commonly and most severely impacted. The respiratory problems are the ones that can lead to the hospital admissions with possible intubation, being placed on the ventilator. That's the ultimate concern. So taking care of the lungs at home is vital, but many people don't know some of the simple tips that they could be doing. For instance, monitoring oxygen saturation is important. Even when people think they're breathing fine, the virus can lead to lung inflammation that reduces the amount of oxygen available to circulate in the body. Many physicians recommend doing some of these tips at home to keep your lungs in good shape. First, buy a pulse oximeter which can monitor your oxygen levels. You should check it 2 to 3 times a day. I got a cute little one on Amazon that slides over the finger. Knowledge is power. You also should stand up and walk around at least every 2 to 3 hours. Part of the issue with this illness is that there's an extreme amount of fatigue and total body aches. So just the idea of getting out of bed or off the couch is a big deal. But simply walking around your house exercises your lungs, forces you to have deep breathing. I always recommend this in my post-op tonsil patients because they want to lay around because of the severe pain from a sore throat. Got to keep those lungs activated. So like I said, getting up every 2 to 3 hours is great. Of course, getting up every hour would be wonderful. Get up, do a little jig, a silly dance, walk around the bed, march in place, get back in bed. Between those lung breaks, be sure to rest for the first 5 days especially, meaning no, don't do the dishes, don't do the laundry just because you're feeling better. Doesn't matter how you're feeling, this virus is having a significant impact and your body needs time to heal. The next thing you can consider is buying a spirometer. This is a little plastic gadget that has plastic balls in it, and the goal is to blow through this tube to keep the balls in the air. This is a deep breathing exercise for when you just can't get out of bed. This is used all the time in the hospital for patients who are bedridden. It's called incentive spirometry, just good lung exercises. And another thing that you should do in your home is to lie prone as much as possible. This is one of the best tips that you can have for helping to take care of your lungs. A few doctors have recognized that this is a hard thing to do, so they recommend frequent body positions throughout the day when you're not sleeping, such as 30 minutes on your left side, 30 minutes on your right side, 30 minutes prone on your stomach, then 30 minutes comfy lying on your back, then 30 minutes sitting up. This is continuing to move around so that the mucus doesn't collect in the lungs. And the last 2 tips to help take care of your lungs is, this is a perfect time to quit smoking and also to stop vaping. There's no reason for external damage to be happening to our lungs. Now on to some medications your physician may prescribe to help beat COVID infections. You would have to be living under a rock if you have not heard all the vicious debates about medications touted as the cure, the absolute miracle to beat the COVID-19 infections. As previously mentioned, there is no single cure for everyone. Your physician will decide on a case-by-case basis which medication is recommended for you. It is not a shotgun approach where the same medication is to be given to everyone. We do not treat every pneumonia or sinus infection with the same medication, so it makes sense that COVID-19 patients don't all respond the same to treatment protocols. That's why it is so important for physicians to continue to use the potentially useful medications in large controlled studies so that the true value can be determined. Who is it best for? What is the best dose? What stage of disease is it best given? This type of information is still being discovered and scientists need more time to finish their work. So, for those reasons, I am not going to jump into the fray and discuss hydroxychloroquine, remdesivir, or the convalescent plasma serum. Those are higher level discussions that I'll leave to the other physicians. But I am going to talk about some other medications that are commonly used for other health problems that your physician may choose to prescribe to you. One is asthma inhalers. Albuterol is for immediate relief to open a constricted airway. They may also prescribe an inhaled steroid for chronic swelling that doesn't readily reverse with albuterol. Oral steroids are, in general, steroids are the ultimate anti-inflammatory drug. So it seems like it would be a no-brainer that it would be helpful for people with COVID, but that's just not how it's worked out so far. Right now, It is not routinely recommended as an outpatient with COVID-19, but a recent study has shown that these steroids are helpful in hospitalized patients with severe or critical COVID infections. Right now, it has not been proven to be beneficial in the large studies, but your physician may prescribe it because you may have an underlying problem that makes you a good candidate for it. The next medicine you might get is an antibiotic, and of course the antibiotic does not fight any viral infection. The most common that are prescribed are azithromycin, the classic Z-Pak, or doxycycline. Because there is so much injury to the lungs, it's common for mucus to collect and for there to be a secondary pneumonia. So if your physician is prescribing an antibiotic, it's because they are trying to prevent an infection. It is not fighting COVID. Baby aspirin is also recommended by some physicians because of the clotting that can happen with inflammation of the blood vessels. We've heard a lot about healthy people who've had strokes and heart attacks due to this inflammation. So in addition to baby aspirin, other physicians may be prescribing some higher-powered anti-clotting medications. Eye drops is also a common thing that's prescribed because COVID conjunctivitis, eye infection, is also a common thing. We have repeatedly emphasized the importance of wearing a mask to cover our nose and our mouth. Let me say that again. The mask covers our nose and our mouth. Having your nose sticking out of your mask is equal to not wearing a mask, but I digress. Anyway, we wear the mask as a protective barrier. But what we haven't talked about a lot is that COVID that's in the air can enter our body through the eyes. And that's why healthcare professionals wear goggles, they wear face shields. So you might consider, if you're around a crowd of people, even though we don't encourage it, wearing glasses, sunglasses or goggles might be something to help protect your eyes. Zofran is another drug physicians may prescribe. It's great for nausea and vomiting because those stomach and intestinal problems can become very serious. And finally, Tessalon pearls are something that is good for people who have such severe coughing that they cannot get comfortable. In general, do some little things to make you feel better, such as drinking some hot tea, hot water with lemon. Adding some honey can actually have several benefits. Number one, tastes delicious. Duh. It also dissolves, and when it dissolves, it can soothe the back of the throat, which is inflamed and raw, so it's actually very comforting to a raw, sore throat. But also, did you know that honey actually has some medicinal properties? It has some antibacterial and anti-inflammatory properties. Some physicians recommend 2 tablespoons of honey a couple of times a day. Warning, warning, always think this when you hear honey. Honey should never be given to an infant under age 1 because their immune system is immature. They may go on and develop a serious problem called botulism. Now, the last thing that I want to touch on, I know this has been long, but bear with me. The last thing I want to touch on is household transmission. When COVID-19 infects a household, all family members don't necessarily contract the disease. If possible, it's a really good idea to try to reduce the spread of the disease during this home quarantining period. It can be challenging for anyone, but it's especially difficult with young children who are isolated from their siblings. But do the best you can. Some tips that you might keep in mind is try to keep the person who's infected in a separate room or floor if possible. Use a separate bathroom if possible. Maintain that 6-foot social distancing from other household contacts. Wear a mask around the house when the infected person is around other household members. Of course, covering the mouth and sneezing. This is good for everybody, not just when you're infected. Frequent hand washing. Avoid sharing household items, dishes, cups, silverware, and clean the high-touch surfaces in the house with disinfectants as much as possible. So we are still in a very active phase of this COVID pandemic, and I'm hoping that some of these tips will resonate with you and help you be more prepared. All right, then. Looks like this is finally a good place to stop. For now, I gotta go. Thanks for tuning in and hope you come back and check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to Apple Podcasts or wherever you go to listen to your podcast and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in any episode, a summary of the show can always be found online at drmamasays.com. Also, don't forget to subscribe if you've not done so already. Hope you come back and listen again soon.